Welcome to Adapt NCLEX, and thank you for deciding to watch this video. I have very two quick questions as usual on select or apply, just to stimulate your mind. Select or apply is a content form of knowledge that you need, teaching, assessment, and risk factors. So two questions. If you know it, it's straightforward. If you don't know, this will be good for you. And let's get to it. So in an Adapt NCLEX way, the way we read a sort of question or any other questions from the back, select all that apply. The next should anticipate deficiency of which of the following due to the allergy. So the question being asked is, what deficiency are we looking for? And here we have the case, a 15-month-old client was diagnosed with a cow's milk allergy after exclusive feeding with the commercial milk. The nurse should anticipate deficiency of which of the following due to the allergy. So the kid was fed milk from cow, so cow milk. Now the kid has allergy. So which of these will be the kid will have deficiency to, because they cannot take the cow milk anymore due to the allergy? So the content to answer the question is you have to know what cow milk is and what you provide to the kid. There's only two things, calcium and vitamin D. They are needed for bone maturation and for growth. Vitamin D helps with calcium absorption. And so since the kid is lacking the cow milk because of the allergy, the only thing that the mother has to do is to provide extra source of vitamin D and calcium. Therefore, vitamin A is wrong. Usually you make vitamin K is wrong. It's from the bacteria in our gut. So the bacteria in your intestines make vitamin K. So the kid is not going to have any problem. There's very minimum source of iron. This is a trap in cow milk. So don't worry about it. The best source of calcium is in a cow milk for that kid. Magnesium doesn't involve in cow milk. Vitamin D, excellent. And vitamin A is not. And so the mother has to provide some source of vitamin D and calcium. And that is like dark green vegetables. It's a good source. Juice is a good source. Beans is a good source. Okay. You can have calcium fortified cereal. That's why sometimes you have cereal with calcium fortified. Yeah, that's very good source of it. Like I said, dark green vegetable is a good source. Vitamin D, you can just go outside and make vitamin D. But if the mother want to give the kid, you also need fish oil. Fish oil is also good. Egg, the yolk of egg is very good for vitamin D. And like fruits, some of the fruits have vitamin D, very good. And so this is orange juice. It's a good source of it. So the mother has to make provision for all this for the kids to ensure that they are not deficiency in calcium and vitamin D. And as you can see, straightforward, it's a content, you know what cow makers and you know what it contains, and then you can answer this question straightforward. Which of the following electrolytes abnormalities the nurse should anticipate? So the asked question is what? I'm looking for electrolyte that should be abnormal in certain situation. What is the case? A 2-year-old was diagnosed with pyloric stenosis after 72 hours of excessive projectile vomiting. So you have kid with pyloric stenosis that have been vomiting for 3 days. Which electrolyte abnormality do you expect? So pyloric stenosis, quick content, there's hypertrophy of the pylorus here. So the kid eat food, it cannot come up from the stomach, stay in the stomach, and then they have projectile vomiting. So they have excessive vomiting. And what is happening? They lose all the fluid, and that happens, the kid get hungry again. When somebody is vomiting that much, it's the same thing as having NG2, taking all the gastric content. If you're removing the gastric content, you're losing sodium, plus the acid that the stomach make, and the acid come with the chloride. So the sodium, hydrogen ion, and chloride ion. So this is the electrolyte that is deficient every time you vomit. And this is what causes the dehydration. So your body will say, I need to hold on to more sodium. So the kidney come in and he said, let me hold on to sodium, but you got to pay for it. You got to get rid of potassium. So in the end, what will happen through the renin-angiotensin system, you have low sodium, low potassium, low chloride, and metabolic alkalosis. Alkalosis because of the acid that you have lost. So the electrolyte abnormality will be hyponatremia, good. Hypokalemic, good. Hypokalemia, good. Metabolic alkalosis, not acidosis. Hypochloremia, good. It's not hypernatremia. So you have to know this lab work. Anybody who have vomiting as NG2, pyloric stenosis, they have hyponatremic, hypokalemic, hypochloric, metabolic alkalosis. This is how you answer SATA questions. It's all content, and it's straightforward. You don't have to think too much. You don't compare, but you take your content and analyze it with each of the individual answers. And if it meets what you expect, you just pick it. So take care of yourself, keep charging, subscribe to the channel. If you need more help with SATA, just check the channel. We have a bunch of them. And then if we need help also with the new generation, this is the place, because we deal with content that apply multiple med-surgical questions. Take care of yourself and have a good day. All the best of luck.